Hi, everybody. My name is Cindy Campbell. I'm an RN of about 30 years, and I'm working with the Cooperative Care Alliance as a contributor on the Virtual Care Network. The Virtual Care Network is a site designed specifically to support personal support workers. So, because a lot of personal support workers' clients are older adults, I thought it might be valuable to share my experience as a longtime OR nurse who spent a lot of time working with cataract removals and lens implantations, just to help PSWs get a better understanding of this procedure when their clients have one. So, today we're going to talk about a review of what is a cataract and the surgery to remove them, what to expect during the various phases of the surgery, home care instructions, and just a review of how clients should put in their eye drops correctly. So, what is a cataract? According to the Oxford Dictionary, cataract is a medical condition in which the lens of the eye becomes progressively opaque, resulting in blurred vision. It can also lead to blindness, sadly. How are cataracts removed? Cataracts are now removed very easily in day surgery settings using microscopic instruments and a process called phacoemulsification. This employs ultrasound to break up or emulsify the nucleus. And then a little vacuum is used to clear away any of this emulsified nucleus, and it does in fact sound just like a little futuristic mini vacuum. The area is then irrigated and aspirated, any of the cortex or any of the residual medications that have been instilled into the eye. And finally, a lens is implanted based on preoperative measurements. So before the surgery, be sure to remind your client to read and follow any instructions given to them by their doctor's office. This will include that they are to have nothing to eat or drink for an extended period before the surgery. And this can range depending on the setting, so be sure to confirm. They'll also be told they have to have an escort home. Once they get to the clinic or the hospital, eye drops are going to be administered and their health history is going to be reviewed by generally a nurse and who's ever giving the sedation, and an IV will also be started. So once they're brought into the room or during the procedure, they're going to be positioned lying flat on the bed under a big microscope. If anyone has issues lying flat, discuss it with the team. There are options. Disposable surgical drapes will then be placed over them to expose only the eye, and the head's going to be taped just as a reminder to not move it. If this sounds rather claustrophobic, do not worry. Generally, this is not an issue. The drapes have little props under them to keep them up off the face, and there is some oxygen flowing underneath as a nice diversion. Some light sedation will be given, but that's only for the purpose to reduce anxiety, not to make the client fall asleep. This is important because we need the patient to be able to respond to oral commands, such as moving their eye if they need to, up or down, depending upon where the surgeon needs them to be. And just as a tip to any client who is nervous, first of all, 99.99% of everyone gets through this totally smoothly, and there's nothing to be nervous about. But to help reassure, tell your client to let the team member know, generally the person who's giving them the sedation, that if they squeeze the person's hand or slightly raise their hand, that's a sign that they might need the procedure to stop temporarily. And this is to avoid calling out or moving the head, which can be detrimental to the surgery. Generally, when it's a cataract alone, these procedures are done very quickly, likely in a matter of about 10 to 15 minutes, depending upon the circumstance. After the surgery is complete, the eye will have a hard plastic shield over it. And this shield is to protect the eye from dirt, debris, or getting scratched. Any discomfort after the procedure is usually described sort of like the feeling of an eyelash or grit in the eye. Discomfort is minor, and it's usually relieved with over-the-counter pain meds like Tylenol. But again, any of those would be discussed with their doctor to see what's best in their situation. After a period of observation, getting something to eat and drink and being deemed medically fit to go home, your client will be discharged anywhere from about 45 minutes to an hour, depending. And when they go home, they're going to be given follow-up instructions and an appointment as to when the doctor would like to see them again. So home care. Your client is going to follow those home care instructions because every surgical center is different, every procedure is different, patient's different, and every doctor may have different requests. So, as we said, instructions can vary, but generally, the client is told to keep that eye shield in place for the first few days after surgery. It will be kept on for more of a long term basis following that period, but generally only while they are sleeping, or if there's going to be a time when they may inadvertently or scratch the eye. Right after your surgery, the client's going to be told to avoid getting the eye wet, and this because it increases the risk of infection or irritation. So allow at least one full night of sleep before showering, and even then, prevent steam or direct water from hitting the eye. Their doctor can tell them when it's safe to begin doing things like swimming, taking a bath, or having hot tubs again, but expect it could be a few weeks. In the postoperative phase, it's important to limit activity that might bring pressure to the head. So bending down low or pulling on, like to pull on shoes or lifting anything heavy. And this is most important just in the really immediate postoperative period, but their doctor will advise them as to when they can start taking on activities that are a bit more strenuous, back to their old exercise levels, etc. During the immediate post-op phase, your client may find that sleeping with their head slightly elevated for the first few nights may help to reduce some swelling, if they can do that. Just because lying flat can often sometimes pool fluids or exaggerate swelling somewhat. For the first few days post-op, the eyes will be very light sensitive, so your client will want to have a pair of sunglasses on hand if venturing outside. And that said, there's some caution around driving, since based on recovery readjustments to light and brightness, things like headlights or the sun may seem very different, and driving may take a bit of getting used to again. So their doctor can best confirm when they are okay to drive. So again, minor discomfort of a scratchy feeling is normal, but what would not be normal is to have severe pain, seeing floaters, having visual disturbances. All of those things would warrant contacting the doctor's office or emergency services. This is just a real quick go through on some eye drops review because I often see people putting in eye drops incorrectly. So let's just go over a few real basics. So if you're watching your client put in their eye drops, always first of all check, but generally the intent of most eye drops is to not be on the eyeball itself, but rather to be aimed into the pocket that is beneath the eyeball. The drops also have to have time to disperse through the eye to do their job. Always wash your hands before and after the client is putting in any kind of medication. And if your client needs help removing the lid or the cap of an eye drop, always try to follow best practice, and that is to always put it on a clean surface. And the best thing would be is to avoid putting it down onto the counter in the same position that it was on the bottle. So meaning in that way, if you put it down, it can pick up contaminants from that counter and then can contaminate the product itself. So rather best that when you take a lid off to put it in the opposite direction of what it was on the bottle. So facing up, so to speak. So your client should sit or lie down, tilt their head back and their chin up when putting in eye drops. And remember too, to not let that tip of the dropper touch the eye itself or eyelashes, because that can also contaminate the tip. After the eye drops are inserted, an index finger is placed on the inner corner of the eye and nose and just gently press there for about a minute or so. And that just helps to disperse the product through the eye and helps to avoid it from just draining out into the nose and mouth. If your client needs to put in more drops of another medication, tell them to wait at least 3 to 5 minutes to let that first drop absorb before putting another into the eye. And also remind your client that after using eye drops, sometimes their vision can be very blurred. And to avoid anything like a fall or a problem, have them wait until their vision returns to normal before resuming any other activities. Okay, that ends our talk today. Thank you so much, guys. And please join us on the Virtual Care Network for more practice tips for PSWs.